It was 1 month ago today that President Trump declared the coronavirus crisis to be a national emergency. That is a technical thing that has consequences that should have put agencies like FEMA in control of coordinating the national response to that national emergency. But instead, who knows who's in charge or what they're doing. You might remember the actual optics of that declaration of the national emergency a month ago today. That's where everybody was crowded together in the Rose Garden like they were all taking a super tight elevator ride to nowhere. And the president kept shaking everybody's hands and touching the microphone that they were all speaking and breathing into. That's where the president announced that there would be drive-through testing sites with major retailers like Walmart and CVS all over the country. They'd be ubiquitous. They're just about to open. A month later, there are less than 10 of those operational in the entire country. The federal government was also, he announced, going to partner with Target. You'd be able to get tested in Target parking lots. How convenient is that? The federal government, it turns out, is not actually partnering with Target at all, and you can't get tested in their parking lots. The president also at that event brought up one CEO who, to his credit, did show the president how to elbow bump him instead of grasping his little hand. The president brought that CEO up to say that his company would be rolling out in-home testing for people getting at-home health services and for people in rural areas. That's just not happening at all. NPR followed up on that big splashy announcement today. Quote, NPR called more than 20 of the company's sites in 12 states. None of them is doing in-home testing. 1 month following the Rose Garden address, employees at the company's site said they lacked both testing kits and the training to administer tests. But still, the announcement sounded so good. That was the same Rose Garden announcement a month ago today, where the president said that 1,700 engineers from Google were all working on a nationwide online screening tool that would be rolled out soon. It would tell you whether you should get tested and where you should get tested, and then it would tell you your results. Vice President Pence said he'd have further details on that. The rollout of that would come within 2 days. Google never actually worked on that at all. A related company did do something much smaller in conjunction with the California state government, but that's just for 5 counties just in that one state. Literally a month ago, there was the president and vice president in the Rose Garden announcing it was rolling out nationwide. NPR also reported on a request that major testing labs made of the White House and of the federal government in conjunction with that same national emergency declaration in the Rose Garden. The testing companies asked the White House for 3 things now that this was a national emergency. They asked for government funds to build new testing facilities, national standards to prioritize who gets tested, and they asked for government support of the supply chain. Quote, more than a month later, the diagnostic testing labs still have those 3 requests outstanding because the government hasn't done any of those things they asked for. Our testing numbers right now aren't even going up on a daily basis. The number of tests being processed each day in the United States is flat or even down within the last few days over the COVID tracking project. I mean, I've heard all this talk about opening things back up and what day we're going to be opening things back up. What do you need in order to open things back up? You need to have a whole bunch of stuff in place if you don't want to just go back to putting tens of thousands, if not hundreds of thousands of American lives on the chopping block. I mean, there's no way we can even start to think about opening things back up unless we've got a few things in place, right? You need to have robust nationwide testing in place. A robust nationwide testing system that allows for widely available, easy screening for this disease. You've got to have contact tracing for people who do turn up to be positive, to figure out who else they've come in contact with, who also needs to be tested, who also needs to have their contacts traced, who also potentially needs to be isolated. You need intense epidemiological surveillance systems in place if you are going to reopen and you know this virus is still circulating among us. We have none of that. None of that. You can't talk about opening things up just because you want things open. You have to have the things in place that will allow you to open things back up without killing thousands of Americans. We have nowhere near any of those things in place. And this is the crucial point. It's not getting better. It's actually getting worse over time because the federal government over time is not improving their response. We're not getting more testing. We have less testing. We're not solving the medical supply chain problem on the national level. The federal government is stealing stuff from the states. That's their plan right now. That's a bad plan. The states are paying 3, 4, 5, 6, 7, 8, 9, 10 times what they used to be paying for some of these supplies. So they're spending that money, and then the federal government is coming in and stealing them. That's how we're dealing with our medical supply chain crisis. Right? Republican governors still don't know, apparently, that they ought to be putting in place stay-at-home orders, even when they've got huge clusters in their largest cities. They have no idea that means they should put in a stay-at-home order. Instead, what the message they're getting from the White House is that they really ought to try that malaria drug that the president says has fixed everything or will soon. So instead, that's what they'll work on. I mean, it's not getting better. The federal government is not learning. The federal government is getting worse. The response is getting worse. We're going to focus in the next few days on the people whose lives are most on the line because of it. We're going to focus in the next few days on nursing homes, where the federal government is not even counting cases or tracking them, let alone making nursing homes get better at dealing with what is ripping through nursing home populations right now. They're not working on that part of the problem. They are not even counting or tracking those cases. That may cost more American lives than any other thing that's going wrong. So we're going to focus on that over the next few days. We're also going to focus on what we can do if the federal government never does get better. Some governors, particularly in hard-hit states, are now starting to realize that the federal government isn't going to spring into action here. And so states are starting to get together in small groups themselves to form slightly smaller subsets of the United States of America, basically to try to approximate, to try to artificially imitate what it might be like if there was a national response. Because there still isn't. One governor who's trying his best, linking up with other governors now in very trying circumstances, is going to join us live next. Stay with us.